Hello, I'm Shivram Singh and I have been trained in NHS. All my plastic surgery training is here in UK, and I have also have expertise in many of the cosmetic procedures. My basic training has been all over the country here, with main training being in London. I perform surgeries including breast augmentation, breast reductions, lifts, breast lifts, and eyelid surgeries, prominent ear corrections, and many other surgeries of shorter procedures. I consult my patients with a thorough consultation, and this involves quite a bilateral communication with my patients. I give them the options to explain the reason why they are with me today, and I try to give them all the available information prior to my consultations. My consultation usually lasts about 20 to 30 minutes, and I take great interest in understanding the requirement of my patient and also give them a lot of information with what procedure I would be performing. It entails both in written communication and verbal communication, which also ends up with taking photographs of the particular areas of concern for procedures to compare the post-op procedures. At the consultation, patients expect to have full information, and we as a medical professional we wish to take all the details, including their age, their body weight, their habitus, and also their social habitus, including smoking, the body weight. We also, at the time of consultation, we take great importance to make sure the patient is comfortable and is understanding all what we explain in common terms. We also explain in great detail about the risk and complications of this procedure, and also we can go in great details to explain what the follow-up would be following these procedures. Not only do we include the details of an operative procedure, but we also make sure we have a team of medical members who also take care of post-op follow-up, including post-op dressings, post-op communications, and subsequently wound healing by being taken care of by one of the specialist nurses. At the end of the consultation, we make sure the patient has understood all the consultation process, and also give them a chance to ask questions if there are any which concern to the particular procedure. And also, we also make sure that they understand and they meet people who also advise them on the time and duration of surgeries and the place where the surgery would be performed. With regards to their past medical history, we do advise them on various medical medications they take. For example, if they are on a long-term medications, we make sure the medications are appropriately administered, and sometimes some medication needs to be stopped before surgery. And we do have a very close communication with the local general practitioners who advise us on their past medical history. Especially when cosmetic surgery, smoking has been a serious concern for wound healing and the outcomes. So we do advise our patients to stop smoking at least 4 to 6 weeks prior to surgery, which helps the wounds to heal better. With regards to massive weight losses or massive obesity, we advise patients to lose weight and return for surgery to get a better outcome. There are other forms of medical issues, including anxiety, depression, or other psychiatric disorders, where we also get help from our general practitioners to ascertain that the patient is stable prior to undergoing this procedure. And at the end of consultation, I get a declaration signed where I declare that it is myself alone and no other surgeon takes the responsibility, and I make sure that it is me who's delivering the service, and also make sure that patient understands what the procedure is and is fully aware of its risk and complications and has no further questions to ask on this prior to signing the consultation form. This doesn't mean that he or she has signed his consent form for surgery. but the consultation ends up with a signature of both the consultant and the patient with an agreement to say they're happy to proceed.